Good day, viewers. Welcome once again to the YouTube channel of Novacrest Hospital and SIPMED, which is Center for Information and Prevention of Mental Disorders. Here with me once again in the studio is our consultant mental health physician, Dr. Uchendu, UI. And today we're going to continue on our series where we've been listing the predisposing factors to mental health disorders. And today we are going to discuss the predisposing factors to mental health disorders occurring in infancy all through to 6 years of age. Sir, over to you, please.
You're welcome, viewers, to this very important topic that focuses on predisposing factors relating to mental health illnesses or disorders. Why is this very important? Because it is the core of prevention. If we're able to reduce the incidence and prevalence of mental illness, we're actually going to focus on the predisposing factors. Like the moderator has said, we're going to just look at the last topic was on, when we talked about neonatal stage. Now we're going to talk about what are the predisposing factors from the time of infancy to about 6 years. And these are the areas that are very, very important in the life of every child as far as mental health is concerned. At this stage, several things could happen. From the acronyms we used in the past, teens, we talked about trauma. We all know that this stage of, from toddler, infancy period to that age of 6, children are very, very active. So trauma could occur probably due to fall or due to probably children fights or whatever. And that could, if that trauma affects the brain, is going to affect the continuous development of that brain, and it will impact on that brain development negatively. Trauma also could be due to psychosocial or environmental factors. At this level, at this stage of life, if there is loss of any of the parents, especially that of the mother, it could affect the development of the psychological development of that child. Divorce could also probably affect these young ones psychologically at this point in time in their life. So when we talk about trauma, we look at it at the biological trauma, we look at it as psychological trauma, and probably social trauma. And we also, when we're talking about social trauma, effects of war on children of this age, effects of terrorist attack on children of this age, anything that displaces these children from their home, and they are now packed in an environment where there is no privacy, where there is no confidentiality, where probably the parents do not have the power or probably the what it takes to show them love, to show them all that it takes to nurture them psychologically. This actually could affect them at this age psychologically and could predispose them to several mental health challenges later in future. Such mental health challenges could be either anxiety, post-traumatic PTSD, disorders. Children get into some of these things probably due to disruption in the environment. Then we look at, apart from the trauma, we look at infection. We have made mention of infection. We know that, yes, that we talk about immunization. So here we want to emphasize that mothers should ensure that their children are immunized at the right time. Polio has not been fully eradicated. all over the world. In some areas, like as it's happening now in Gaza, there's polio vaccination because polio viruses resurfaces due to probably the environmental situation there. So vaccinations are very, very important to help these children grow healthy, at this stage in their life. Because when they have these medical conditions, it could affect them psychologically, and probably later in life, any precipitating factor could tip them into having mental health challenges. We talk about nutrition is very, very important. We talk about nutrition, very, very important. At this stage, they need all that it takes. They need iodine, in their salt to ensure that their thyroid gland develops very well, that they have enough what we call good level of thyroxine that helps their brain, help their metabolism. These things are important in prevention. That's what we are talking about. That's what we are talking about, predisposing factors. Then we have made mention of substances. Please, we advise that parents should not be drinking alcohol, smoking cigarettes in presence of their children at this stage in life. It could, one way, make them probably for smokers, make them to be passive smokers. When they are passive smokers, with time, probably their brain will be sensitized, and as they grow, they might be drawn into using some of these substances. So like we have said, when we talk about predisposing factors, I want us to be clear about this. Predisposing factors are factors that makes one vulnerable to be affected with mental health challenges later in adult life. Even though that children can probably at that age, due to some conditions around them, it could be biological, it could be psychological, it could be social, could come down with some mental health challenges, but the predisposing factors are kind of the foundation that makes people vulnerable, the platform that makes people, so that when there are other triggers that we're going to discuss later, when we start talking about the precipitating factors or perpetuating factors, we'll be able to always refer back to these predisposing factors. These predisposing factors, these are things I want to emphasize again, that actually leads that if we can reduce or eliminate as much as possible, it will be able to help in reducing the incidence or prevalence of mental health challenges that we see around us. After this, in the next episode, we're going to look at the summary at every stage of our discussion, from the pregnancy to the delivery to the neonatal stage to this infancy to 6 months. What are the key factors that we should be looking after, that we should be able to create awareness and let people know that these things, if we don't take care of them, they are likely to create problems for our children later in future. And when we get to understand these things, it will help us to reduce the mindset that we already have in the society, that mental health challenges are due to spiritual causes like spirits and demons and whatsoever that people believe. And unfortunately, this mindset makes them to go to areas where they will not get help. Instead, they are being deceived, they are being extorted, and at the end of the day, the society continues to suffer. So I want to appreciate you for tuning in and hoping that in the next episode, when we summarize, if there are questions, on predisposing factor, please don't hesitate. Let us know, and we are here to answer every question that might be troubling your mind. Thank you.
Okay, there you have it, viewers. Thanks once again. Please, for those who have comments, please drop them in our comment section. Like this video, share, and subscribe to our channel. See you in the next series. Thank you.